Hi everyone, my name is Maureen Green. I'm a licensed therapist in California, and today I'm going to talk to you about trauma and its impacts. I'm hoping this video will be helpful in realizing your own roots and connections to trauma and guide you in your healing journey. Today I want to share two misconceptions that are very common that over the past 16 years in my practice I've seen time after time. In the end, I will share two ways you can assess yourself for this and seek out the kind of help that would be effective and not go from therapist to therapist, medication to medication to find the right kind of help. So misconception number one that comes up quite a bit in my office is if I haven't been assaulted, if I haven't been physically abused, if I didn't go to war, if I wasn't molested, raped, and haven't been a direct victim of some kind of violence, then PTSD or trauma has nothing to do with my presentation of suffering in current day. So that excludes quite a bit of exposure of trauma for the general population that we're not including in that definition. I would say in mental health, we often talk about little t and big T trauma. And little t is dismissed quite a bit. And one of the things that's dismissed is growing up as a latchkey kid, having to do a lot of things on your own, regardless of the reasons. Maybe the reasons were poverty, maybe reasons were your parents were very busy, maybe you were assumed to be overly responsible early on, even though it wasn't developmentally appropriate. This does not help us develop into secure, grounded adults. It has impact on our development. Another common area that we miss is really having emotionally attuned parenting. And this isn't done intentionally most of the time. Often parents are busy. We have single parent homes. We have homes who both parents work and are not able to provide the kind of attention that their children need. Also, a lot of parents have their own history of trauma and haven't really released it and created some healing for themselves. The challenge has become that the homes do not create an atmosphere where sense of belonging and sense of security and lovability is sacred. Most families are busy and running around with a whole bunch of activities. A typical family has multiple kids with multiple activities where emotional development is not at the top priority. School is priority, maybe athletics is priority, but emotional attunement is not. So we grow up really without a sense of solid identity, and then as adults that shows up in our relationships. Those are two ways, but there's also additional misconceptions that are missed. Things like discrimination, racism, cultural trauma, generational trauma, being exposed and witnessing domestic violence among your generations, uncles, aunts, parents, grandparents, even if you've never been physically hit yourself. So that's misconception number one. Misconception number two is panic attacks, anxiety attacks are a disease and need to be medicated, and you have to manage that for the rest of your life. So I'm assuming you can relate to that. You've heard that before. Most people call it an illness of some sort and go to therapy, or some end up in the hospital due to feeling like they're having a heart attack. You may have had those experiences. And then they get told that they need ongoing therapy as well as medication. Well, what I want to communicate about that, and you can assess yourself later, is panic attacks and anxiety is a form of communication from our body. And we don't, as a society, know how to listen to our body's language or even interpret what our body is trying to say. So we suppress, we numb, we distract, we stay busy, and our body gets louder and louder over time, going from maybe small anxiety and worry to, panic and terror and fear, and even states of agoraphobia where people are afraid to leave their own homes. So panic and anxiety are the language of the body, and it's not a disease that you have to live with for the rest of your life. It's healable. It is rooted oftentimes in trauma. Yes, there are some of us who are born neurologically more predisposed to anxiety and our worry warts. That's different from anxiety and panic attacks, and we can talk about this in some future videos. So, 2 misconceptions discussed. Now I want to offer you 2 ways that you can self-assess at home that will give you a lot of information if trauma has roots to your current suffering. Number 1 way to assess yourself is ask yourself, what are you avoiding most of your days? Are you avoiding sitting still? Is it difficult for you to stay put? Are you always feeling like you need to have a to-do list? If you're not accomplishing things, if you're not checking things off, it's uneasy in the body. It feels guilty to rest. It feels lazy to take care of yourself. It feels selfish. So that's a sign that somewhere deeper, that's born out of those ways of being on the planet, is born out of some traumatic roots. Other ways to assess yourself is if you're avoiding crowds, if you're avoiding small spaces, if you're any form of avoidance that evokes an intense reaction in your body will have some roots in trauma. Now, this trauma could be a large trauma, like an assault of some sort, or it could be small, little t traumas that most of us don't even think of as traumas. One of the biggest ways we can assess if we have been impacted by trauma, especially on an emotional scale, is if we are avoiding being in our body. Most of us exist from the neck above, and our head is just, what our body carries around from work to home. We're not in tune with what's below the neck. And when something arises inside of us, some form of suffering, some form of painful emotion, we look for quick ways to numb, distract, avoid, suppress, essentially oppress our experience, our body's language. So that's not what we're born with. We are not born knowing that information. We learn that, and we learn how to deny our internal truth from somewhere, and it often has roots in trauma. So I encourage you to ask yourself that question. One way to know this is, am I avoiding feeling? Am I avoiding being still? Is it uncomfortable to be alone? Am I avoiding saying yes to opportunities, whether it's relationships, occupational, making changes in my life? Am I avoiding leaving toxic relationships because I'm afraid to be alone? Most of those have roots in trauma. All right, so that's one way to assess. If you answered yes to any of that, you probably have some roots of trauma. Number 2 way of assessing yourself is if you have overreactions. If you caught yourself responding to situations with more intensity than the situation called for it, it is an indication that there is a wound underneath that trigger for you that is unhealed. And when unhealed wounds are triggered, we don't respond with the intensity that the situation calls for. So let's say it's a situation where most people will be upset about, but they won't be upset at a 10 out of 10. They will be upset at maybe 3 out of 10 or a 5 out of 10 if the 10 is the highest intensity. And you catch yourself going from a 0 to 100 very quickly, not even noticing that that's taking place. And the next thing you know, it's a big, intense response. This could be an external response with anger or yelling, attacking, or it could be an internal response. It quickly shuts people down, withdraws, they detach. Sometimes people even, exit their body in a sense, kind of not feeling themselves in stressful situations. It's a more severe way of detaching from yourself, especially if you've been practicing it for a long time unintentionally. So that's the second way to assess. Do I have overreactions? And can I acknowledge that my response is a little bit higher than maybe the general population? Stay tuned to future videos. I'd love to share with you some ways to begin changing the relationship with your body, in addition to really learning about the #1 federally approved evidence-based treatment for trauma and panic attacks and anxiety attacks, which are part of trauma, that most people are unaware of. Thank you so much for watching the video. Please comment if this was helpful, and if you want additional information around this. We'll see you soon. Take good care.